Welcome to PTCB Prep Guide, where we simplify pharmacy concepts to help you ace your exam. Today, we are tackling a really crucial topic: medical records, law, and HIPAA. We're going to break down the key definitions, highlight the high-yield terms you absolutely have to know, and walk through some real-life scenarios that'll get you ready for exam day.
So here's our game plan for today. First, we'll look at how patient records can actually become legal documents. Then, we're going to get into the nitty-gritty of creating and maintaining them the right way. After that, we'll cover how to correctly fix and securely destroy records. And finally, we'll do a deep dive into HIPAA and PHI, covering all the rules about disclosing patient info. Let's jump in.
So let's start with a question to get the wheels turning. Is a patient's record just a file for tracking their health? Well, the answer is a big, resounding no. It is so much more than that. It's actually a legal document, which leads us right into our first critical section. You see, as a pharmacy technician, you're not just handling prescriptions. You are handling potential legal evidence. Every single entry you make, every record you file, could one day end up in a courtroom. Understanding this responsibility is absolutely critical for your career. For any record to be used in court, it first has to be relevant. This just means it has to be directly related to the facts of the case. So for example, a patient's prescription history for a pain med would be super relevant in a lawsuit about an allergic reaction to that specific drug. Makes sense, right?
Next up is competence. This is all about trustworthiness. A competent record is one that's accurate, timely, and complete. This is exactly why following your pharmacy's procedures to the letter is so important. If a record is messy or has missing info, a judge can toss it out of court for being incompetent evidence.
Okay, let's talk about the word hearsay. You've probably heard it in movies. Hearsay is secondhand information. Like if you testified, well, Dr. Smith told me the patient wasn't taking their meds. Usually, that kind of testimony isn't allowed. But, and this is a big but, medical records are a major exception. Because they're created during the normal course of business, they're seen as reliable and can be used as direct evidence.
Okay, pay very close attention here, because this is a high-yield distinction for your PTCB exam. The difference between a court order and a subpoena. A court order is signed by a judge. It has serious legal authority, and you must comply with it. A subpoena, on the other hand, is usually issued by an attorney. It still requires action, but you need to be very careful and verify everything before releasing any information. Always follow your pharmacy's specific protocol for subpoenas.
All right, now that we've covered the legal side of things, let's look at how good record keeping is really the bedrock of patient safety. This isn't just about staying out of legal hot water, it's about making sure every single detail is right so we can protect our patients. For a record to be considered valid and safe, it has to check these 4 boxes. It has to be accurate, no mistakes. It has to be complete, no empty fields. It has to be timely. An entry made weeks late is a huge red flag. And finally, it has to be properly authored and authenticated. This slide breaks down the difference between authorship and authentication. Authorship is simply who creates the entry. Authentication is who verifies it's correct. Now, that final point on the slide can be a little confusing. In some settings, like a doctor writing their own note, they are both the author and the authenticator. But in a pharmacy, a tech is often the author of the data entry, while the pharmacist is the one who performs the final authentication, verifying it's all correct before dispensing. The key takeaway is that every record needs that official verification. So how long do you need to keep these records? The general rule of thumb is at least 7 to 10 years. Now keep in mind that state laws can vary, so it might be longer where you work. The most important thing to remember for the exam is to never ever destroy records before that minimum time is up. That's a serious compliance violation. Okay, let's be real, we're all human and mistakes happen. So what do you do when an error is made in a patient's record? Well, you can't just scribble it out or hit the delete button. There's a very strict protocol for making corrections and, eventually, for destroying records securely. You'll want to memorize these steps for the PTCB. For a paper record, you draw a single, clean line through the mistake. You want it to still be readable. Then, you write error next to it, add your initials, and put the date and time of the correction. No whiteout, no scribbling. This keeps the record's integrity intact.
And for electronic records, the idea is exactly the same. You never, ever delete the original entry. Instead, you correct it by creating something called an addendum. This creates a digital audit trail that shows the original entry, the correction, who made it, and when they made it. That transparency is absolutely key. When it's finally time to get rid of old records, remember that all those privacy laws still apply right up until the very last second. Paper records have to be shredded or pulped. Digital media needs to be magnetically wiped or just physically destroyed. The goal is to make that patient information 100% unrecoverable. And pro tip, always keep proof of destruction. All right, let's get into the heart of patient privacy, HIPAA and PHI. You are going to see questions about this all over your exam, and it's something you will live and breathe every single day you work in a pharmacy.
So what exactly is HIPAA? Well, it's the big federal law that protects patient privacy. Its #1 job is to set the rules for who can see, use, and share a patient's sensitive health information. Think of HIPAA as the ultimate guardian of patient confidentiality.
And what does HIPAA protect? It protects something called PHI, which stands for Protected Health Information. This is basically any piece of information that can be used to identify a patient and also relates to their health, their treatment, or payment for their care. And it's a lot broader than you might think. Just look at this list. This shows you how broad the definition of PHI really is. Of course, it includes the obvious stuff like names and social security numbers. But it's also phone numbers, addresses, birthdays, even unique personal stories that could identify someone. A simple prescription label is just packed with PHI. Now, this is one of the most important principles in all of HIPAA, the minimum necessary rule. It means that if someone has a legitimate reason to see patient information, you only give them the absolute minimum they need to do their job and nothing more. So, if a researcher needs data on patients using a certain drug, you'd give them de-identified data, not their names and home addresses. This brings us to our final and maybe the most practical section. When is it actually okay to share PHI? Knowing these rules inside and out will protect you, your pharmacy, and most importantly, your patients. This table breaks down the main situations where it's okay to disclose PHI without getting specific authorization from the patient first. You can remember this with the acronym PTO, Treatment, Payment, and Operations. That means you can share info with another doctor for treatment, you can send a claim to an insurance company for payment, or you can use data for internal things like quality control. And of course, patients always have the right to see their own records. Okay, let's recap the key takeaways for your exam. Patients always have a right to access their own records. You have to give them a notice of privacy practices. Never, ever discuss patient information casually, not even in the break room with coworkers. And finally, make sure you securely dispose of absolutely everything with PHI on it, especially those old prescription labels. And let's end with a tough question to think about. HIPAA gives us a solid framework of rules, but at the end of the day, healthcare is about helping people. This question really gets at the ethical dilemmas you might face when the letter of the law seems to conflict with a patient's immediate well-being. Great job reviewing medical records, law, and HIPAA today. You're on the right track toward passing your PTCB exam. Make sure to review your notes, rewatch this if you need to, and practice these concepts. If this explainer helped you out, please like, subscribe, and share to support the channel. We post a new simplified pharmacy topic every single day to make learning easier and your exam prep more effective. Keep learning. You've got this.